Maharashtra has been extended to the 31st of July, and in some senses in Mumbai city, it's stringent. Now, the Mumbai police will impound your vehicle if you're out for a joyride. If you have essential needs like you need to go shopping or exercise, which is all allowed, you need to do it within 2 kilometers. A lot of Mumbaikars were in for a rude shock when they realized today how strictly this is being implemented.
With over 70,000 active cases of COVID-19, Maharashtra has decided to extend the lockdown by one more month until the 31st of July. This time with a new set of rules as the state continues its mission start again. With the new set of rules, the major change is the restriction of movement for non-essential services like salons, spas and exercises to neighborhood areas only. Only those attending offices and emergencies will be allowed unrestricted movement. The government has allowed all the non-essential markets and shops except the malls to remain open from 9 in the morning to 5 in the evening. All government offices will work with a 15% workforce from office, while the same is 10% for private offices. In Mumbai, which is a major contributor to the number of COVID cases in the state, the new set of rules, which was enforced on Sunday night, has resulted in traffic chaos across the toll nakas in the city. The new rule has specified movement for non-essential work to a radius of 2 kilometers. Movement beyond 2 kilometers is permitted only for attending office or medical emergencies. All vehicles found flying away from their local area without a valid reason will be compulsorily impounded. Over 6,800 vehicles have been impounded so far. So while Mumbai police has drawn a 2-kilometer Lakshman Rekha on your vehicles, prominent check nakas like Daisa check naka and Mulund check naka, the toll booth, which allows vehicles to enter into the city from the suburbs, has witnessed long traffic jams.
I'm present at Mumbai's Daisa check naka, and here also you can see that how cops are deployed in this heavy cop deployment. Cops are checking the vehicles. In fact, the vehicles of those who are violating the rule are being impounded. These are some of the impounded vehicles here. Now, who all are supposed to move? Those who have to go to office, people associated with essential services, those people can move, but those who and for medical emergencies, of course. But those who are stepping outside for shopping, grocery shopping, to go to a salon, exercise, all these people have to stay within the limit of 2 kilometers radius of their residence. And if they are violating, their vehicles are not only being impounded, they are also fined. And those who are when police is finding out that if somebody is out just for a joyride, those people are also booked under IPC 188.
So what is the medical reasoning behind the extension of this lockdown in Maharashtra? Now we know the numbers are bad, but to get a better sense on the thought process behind it, and can we really see any difference a month from now, I'm joined now by Dr. Shashank Joshi, a top doctor in the city of Mumbai and of course a member of the Maharashtra COVID task force for the government, for the state government. Dr. Joshi, welcome to the show once again. Great always to speak with you. Please explain why we need another month of lockdown in the state of Maharashtra.
So first of all, nobody likes to be hearing this word lockdown. It's quite negative, and I think we have to be more disciplined in this next month. And the medical reason for this, as you rightfully said, is the numbers are not still looking good. Rest of Maharashtra, the MMR region is speaking up. Mumbai just about probably past its peak, but its numbers are still high. And Mumbai unfortunately has the highest mortality in the country. We still are having a very high mortality, which means people are still dying. Every life matters and we need to save lives. And that's why we need to be careful, we need to be very cautious and very mindful in our unlocking. So it's not that the mission opening has truncated things. I think the lockdown is only meant to tell everybody that it's monsoon. Also remember, in the month of July, we get the worst monsoon and rains in Mumbai city. If you look at the history for the last 30 or 40 years of Mumbai, July is the month where you see the largest rainfall, largest disruptions due to monsoons. And monsoons, corona, July can be a double whammy. And I think they have been very mindful that we need to save lives. Our mortality is high. Our number of cases have just about started bending down. The total number of Maharashtra cases are still very high, and that's why probably
But Dr.
that's
Joshi,
the medical
the question
reason.
I want to ask you is that what?
Yes.
Yes.
No, sorry, go ahead.
No, Dr. Joshi, the question I want to ask you, sir, is that what are we planning to do differently? What are we planning to do differently in this 1 month that we haven't in the last 4 months? I mean, Maharashtra has had a stringent lockdown, one of the most stringent in the country, and from early on as well. So all of these measures have already been in place. Yet the numbers have been increasing. Our mortality rates are also worse than the rest of the country, etc. So is there a plan? The question is that can you have these unending lockdown extensions without a clear plan of what you're going to utilize that time for?
So I think 2-3 things I would like to answer. First of all, it is not just that uniquely Mumbai or Maharashtra is locked down or uniquely India is locked down. The world is locked down. And many parts of the world which have started unlocking have seen disasters. You have seen a disaster in United Kingdom, you have seen a disaster in United States, you have seen a disaster in Brazil. So it's not easy to unlock, and we need a lot of cooperation from people at large. I don't think things have changed. We need a lot of cooperation from people, and in the last 3 or 4 months, we have had geographies and pockets even within Mumbai, within Maharashtra, where the lockdown has not been at its best optimized, effective. Otherwise, we would not have seen these type of numbers blowing out, because we know very clearly that the strict SMSing which we need, which is sanitizing or soap, which is masking, or which is the so-called social distancing, had it been strictly maintained, I think these numbers we would have not seen. But somewhere down the line, some people somewhere have violated, and that's why we are seeing these numbers. And we need people's cooperation. And this, as I said, we have a double whammy of monsoon and corona at the same time when the peak is nearing up, and that's probably the reason that a little more stringent measure has been there. At the same time, a lot of unlocking has happened, but unlocking has to be very gradual, and one has to be very mindful of that unlocking coming in a very systematic way, because we are seeing that as the Greater Mumbai has started settling down, the suburbs, the metropolitan region has started getting the higher numbers. So we are seeing this whole wave and clusters, and we have to all live with corona. I completely agree with you, and we have to mindfully unlock. In fact, now they have opened many more things in essential services than probably what were open a month back and what were open 2 months back. So we have seen a gradual unlocking. We are seeing many more shops being opened, many more establishments being opened, offices being started from a small key to a large key. So definitely there has been some amount of unlocking. You can't say what was there in April is being seen now in July. Definitely we are seeing some upward movement there, but it has been very slow, very gradual, and very, very cautious. I think they have been trying to err on the safer side, because lives matter and we don't want to have a catastrophe. We saw what happened with the early unlocking of New Delhi. A little bit of early unlocking, and you see the way Delhi has exploded. It has outstripped Mumbai, and I'm very grateful that our administration has been much more mindful in their unlocking, because we don't want to see an explosive geometric progression of numbers the way Delhi saw.
Okay, I just want to understand some things in the handling of the entire situation, and this is specifically now for Mumbai. For example, from Sunday onwards, the Mumbai police has said that you should not travel anywhere outside 2 kilometers of your radius. Even in your private car, all your essential services, etc., should be within 2 kilometers. And it's led to quite a difficult scenario where officers are checking vehicles and impounding them. Some 1900 vehicles were impounded on Sunday itself. Is there again any medical reason for this, Dr. Joshi? Because I just want to understand that if a family of 3 or 4 is sitting in their own car, don't step out, maintain social distancing, and take a round and come back, how will it harm anyone or anything? Are we, being in the name of being cautious, are we being a little too controlling?
So I wish everyone is like you, Tamanna, or like me, and I would love to go out for a drive, and I would love to do all these things. But unfortunately, I think the past experience may not have been very cooperative. See, when we need people's cooperation, when does enforcement come in? I think enforcement only comes in, and I cannot speak for the police and I cannot speak for the administration, but I think the reason or logic they might have applied is if people are just not cooperating. probably they need to put some stricter measures in place. And these measures are basically meant to ensure that the SMS or the social distancing is well maintained. I completely buy your point that people, sitting at home, but also remember that there must be an underlying reason. The compelling reason is very clear cut, that numbers are just getting better. We don't want these numbers to spiral up, number one. Number two, we definitely need to dent our mortality. Number three, if we don't take some right steps and we then land up with what has happened with Delhi, then we will be another New York, we might be another United States, and that's exactly what we want to prevent. So I think when the administration has never been so firm, I don't think they have been so draconian even in the last 3 months. And if they are deciding to employ some stricter measures, there has to be a reason and rationale behind it. And the best people to answer that is police. But I'm sure that they must have found that a lot of people may not have been cooperating. And the people's cooperation, people's will is what we need. Look at Tokyo. If people tell them wear a mask, the whole city wears a mask. If the country prime minister tells them that do A, B or C, or the chief minister or the mayor of the state tells them do A, B and C, they follow it to the last T. Do you really mean to tell me that every human being in Mumbai city has been following everything told to them to the last T? Probably not. And probably that's the reason that some of these restrictive measures are there. Remember, there's
It's a
an
little
epidemic
unfair
act
to
in
compare
place.
Mumbai to Tokyo, because are people in Tokyo, I'm sorry, are people in Tokyo living like they do in Mumbai? 8 to 10 in a house. It's
Absolutely.
the fact
I
is
think-
that the city has its own compulsions
let
and
me know.
reasons.
So now let me know. I think I would I know the demography of Tokyo as much as a demography of Cairo, as much as demography of Mumbai, because I am now on a committee which is looking at primary health of urban slums. And we know that we have 60 lakh people in urban slums. So everybody is not as fortunate as all of us to live in a flat. And that's why it's important to recognize that the cluster of Tokyo is as clustered or as population dense as Mumbai is. And remember, they have very high population density in Tokyo or Cairo. I'm just comparing two drastic cities. One is a developed city, one is not so developed city in Egypt. And still, if you look at it from that standpoint, purely from a planning standpoint, we need to be very mindful and we need to cooperate. See, nobody would love anyone to be restrictive, and I understand what you're coming to. I mean, if you are frustrated and I am frustrated, it is a very logical to be frustrated. But we have Epidemic Act in place, we have a Disaster Management Act in place, and we don't have numbers to back up things. If we had numbers and every day 1,000 people are not being diagnosed or 1,500 people are not being diagnosed, every day if you are not seeing 80 or 100 deaths, obviously there will be easing of lockdown. But there has to be some rationale and logic to it. And we need to ensure that we need to save lives, we need to contain this pandemic. And there have been many cities, many countries which have been locked down for six months. So it's not something which is very unique. So I think it's time that people cooperate, and we definitely need to do that. Also, these restrictions, see, all essential services are permitted. If you are going out to doing a valid job outside, I think that's something which is done. Now, this pandemic doesn't come every year, it comes once in 120 years. So, if it is going out of hand and the numbers might spiral up, I think we cannot afford to have another disaster up when we are just about bending the curve. So, I think one needs to have it's a very strict message which is being sent out, that wake up and still be careful.
Do you see
Don't be
things
complacent.
improving after a month? Do you see things improving? Yes, Dr. Joshi, do you see things improving after a month? Do you see any timeline for the numbers improving in Maharashtra?
So three things I want to tell you very clearly. Number one is this virus doesn't follow any mathematics. This virus is predictably unpredictable. We only know on the biology of the virus 6 months of data. So if you ask me, from whatever data generated till now and whatever study we have done up till now, if we do some of these public health measures a little more strictly, probably we will see a better outcome. And we are already seeing a little better outcome after the Chase the Virus campaign started. After we started going into the communities and pulling out people, screening the vulnerable groups, we have definitely been able to dent some numbers in. So I think if we need to keep on chasing the virus and driving the virus out, I think these are directions towards that. I would not justify still the stricter measures. The stricter measures probably will get less stricter if there's a general cooperation from people at large. But when the city is so large and the density is so high, probably some of these measures are taken by the administrators to maintain law and order. So that is their call. That is not something within my domain. From a medical standpoint, from a public health standpoint, probably some of these measures might see us with better numbers and better outcomes.
Okay, thanks so much, Dr. Joshi, for speaking with us. Dr. Shashank Joshi is a member of the Maharashtra government's COVID task force and has explained why it seems like a stricter situation is in place for the next 1 month. Let's hope there is cooperation and this time is utilized to actually improve the situation. We'll take a very quick break at this point. When we're coming back, we're talking about the India Revival Mission and Atmanirbhar Bharat. How can the auto sector wean off Chinese imports? We have the biggest names in the business talking to us on the other side.